Hi, I'm Shelby. I'll be your nurse practitioner student today. Can you tell me your name and date of birth?
Joseph Osterkamp, 4/19/1992.
Okay, and what are we doing for you today?
I'm just here for a checkup.
Alright, so your speech seems clear and audible. It's not slurred, so cranial nerve 12 or the hypoglossal nerve is intact. Just going to check your skin out, make sure it's warm, dry, and intact. Can I see your abdomen and your back, please? Good. Good, and then your legs. Okay. Alright, that all looks good. So I'm going to start by doing a couple tests on your face. So go ahead and close your eyes. I'm going to place some objects on your face. Let me know if they feel hard or soft.
Soft. Soft. Hard. Hard.
Okay. So cranial nerve 5 or the trigeminal nerve is intact. Go ahead and smile for me. And then puff out your cheeks. All right. So cranial nerve 7 or your facial nerve seems to be intact. Can you go ahead and rotate your head around for me? And then I'm going to have you push against my hand. All right. So cranial nerve 11 or the accessory nerve seems to be nice and intact. I'm going to feel your lymph nodes now. We're just going to make sure that they are smooth, symmetrical, and soft. So we're going to do preauricular, auricular, occipital, tonsillar, submandible, submental, anterior cervical chain, posterior cervical chain, supraclavicular, infraclavicular. So that all seems good. And then I'm going to move on to your eyes. So I'm just going to take a peek at those. They look nice and symmetrical. Your lids don't have any lesions or masses. Your sclera is white and clear. Your conjunctiva is pink and moist. So that's good. Your media also appears clear. So we're going to do a couple tests on your eyes here. The first one, I'm just going to have you follow my finger with your eyes. So, alright, and then go ahead, follow my finger with your eyes. Alright, and those accommodate and converge well. Your extraocular movements seem to be good. They are not lagging. So that's cranial nerve 3, 4, and 6 that are intact. So your oculomotor, your trochlear, and your abducens nerves are intact. I'm going to do a couple more tests with your eyes. So I'm going to have you look straight ahead and just make sure your pupils are reacting to this light. They are, and they both look nice and symmetrical and round. And then go ahead and just stare straight at me, and then just looking to make sure the reflection in your eyes is equal, and it is. And then I just need to put my tool together here, but I'm going to assess the insides of your eyes now. And if we were going to test cranial nerve 1 or I'm sorry, cranial nerve 2, your optical nerve, we would have you look at a Snellen chart. So I'm just going to assess your eyes, going to make sure your macula, disc, and cup are intact. So go ahead, just look straight forward. Okay, they look good in that eye. And test this eye. Look good in that eye. Alright. I'm going to move down to your nose now. I'm going to look at it. Looks nice, straight, and symmetrical. Do you have any problems breathing out of it?
Nope.
Okay. I'm just going to switch to a different instrument here. Just going to take a peek up it. Alright. Go ahead, tilt your head back for me. Right, your septum looks nice and straight. And there. And nice and straight on that side. Your mucosa inside is nice and pink and moist. There's no exudate. And now I'm going to test your cranial nerve 1, the olfactory nerve. So I'm going to have you go ahead and smell this candle for me and tell me what you smell.
Smell like lavender.
Perfect. All right, we're going to move on to your mouth now. I'm going to have you go ahead, open up and say, ah.
Ah.
All right. Your uvula rose well. It was nice in midline, so that is the vagus nerve or cranial nerve 10. Go ahead, open up one more time. Just want to take a peek here. Your hard and soft palate are intact. Your mucosa is nice and pink and moist. It's free of any lesions or masses. Go ahead, stick your tongue out and then move it from side to side. Okay, and that is also free of any lesions or masses too. All right, I'm gonna move on to your ears now. Gonna take a peek inside. The outside of this ear looks good. There's no rashes, lesions, masses, nothing there. I don't see any exudate on the inside or outside. No bulging of the media. Your tympanic membrane looks nice and intact over there. And up here in this one now. And same for that one. So your ears look good. I am going to do a test to test cranial nerve 8 or the vestibulocochlear one. So it's a whisper test. I'm going to have you cover this ear with a hand. I'm going to whisper something back here. Just let me know what you hear.
Happy birthday.
Okay. We're here.
Good morning.
Yep. All right. So that nerve is intact. Excuse me. I'm going to now move on to your neck. So I'm just going to palpate here. All right, your trachea is nice and midline. Go ahead and swallow for me. I'm just gonna feel your thyroid here while you're swallowing. And I'm just gonna be testing cranial nerve 9 or the glossopharyngeal, and then go ahead and swallow again. Okay. All right, and I don't feel any goiters, nodules on your thyroid. It's nice and smooth and symmetrical on both sides. I am gonna feel your carotid artery on both sides and then listen to it as well. So alright, that feels nice and normal. It's symmetrical on both sides. It's about a +2 on both sides. I'm just going to listen now for any bruise. Right, and there are no bruises present. So I'm going to move on to your chest now. So, or actually, just kidding. I'm going to do your arms first. So go ahead, shrug for me, and then push while you're shrugging, kind of push against my hands. All right. And then go ahead, put your arms out, do some circles for me. Gonna go ahead right above your head. All right, and then bring them to the front here. Gonna have you push against my hands. All right, and then same with this. Go ahead, do that. Keep pushing against me. Go ahead, grip my fingers. All right, that all seems good. I am gonna check your pulses. So I'm gonna check your brachial. Those are both a +2. And check your radial. Those are also good. They're all symmetrical, +2. Excuse me. I normally would do a blood pressure. So if we were doing a blood pressure, we'd have you put your arms at the height of your heart, nice and straight, and we would check both arms. 120 over 80 would be a perfect blood pressure for your age. Then we're gonna check your reflexes in your arms. So I'm gonna check your bicep. So good. That one's nice and brisk. I'm gonna go ahead, do your tricep. That one was nice and brisk. And your radial one. That one was brisk as well. And we'll do the same thing on this side. bicep. Okay. And radius on this side, or radial, I'm sorry. That one was nice and brisk as well. So that is all good. I'm gonna move now to your chest. I'm gonna palpate, feel for any masses or lumps. Gonna check the central and lateral nodes, and they're symmetrical and smooth and soft. I'm gonna listen to your lungs, so I'm gonna have you take nice deep breaths while I'm listening. Okay, go ahead, start to take some nice deep breaths. Okay, those were clear. Your normal breath sounds. They're vesicular and bronchiovesicular throughout. Your respiratory rate was about 16, so that's also good. I'm going to move on to your heart. So first I'm going to just feel for your PMI, and that's about 2 or 3 centimeters. It's tapping. There's no thrills or heaves present. And then the first time I listen to your heart, I'm going to be listening for your normal heart sounds. So that's aortic, pulmonic, Erb's point, tricuspid, and mitral, and those all had normal S1 and S2 sounds, no S3 or S4, no skip beats. I'm gonna just listen to your heart rate real quick. All right, it's at about 64. Now I'm gonna listen for some murmurs with my bell. So again, at aortic, pulmonic, Erb's point, tricuspid, mitral. All right, and I don't hear any murmurs at those points, so I'm gonna have you lay down now. I'm gonna listen to your heart in the same manner again. So I'm gonna just start with normal heart sounds. Aortic, pulmonic, Erb's, tricuspid, mitral. Switch into my bell for the murmurs. Alright, and those all sounded the same as all sitting up. I'm gonna move on now to your stomach. So first thing I'm gonna do, go ahead and bend your legs up. Just relax those stomach muscles. I'm gonna listen to your bowel sounds. Alright, and you have normal active bowel sounds. I am gonna listen to your aorta, just make sure there's no bruits, and your renal arteries as well. No bruits, and I'm gonna listen to your femoral arteries as well for any bruits. Okay, there are none present. Go ahead, keep your legs up for me if you don't mind. I'm gonna feel for any inguinal hernias. I don't feel any. I feel your femoral pulses here. They're +2, they're nice and symmetrical. Just gonna palpate the rest of your stomach lightly to feel for any hernias or masses. I don't feel any. I'm just gonna do a little bit of deeper palpation here. All right, I'm gonna do a little bit of percussion just so I can find the edge of your liver. Perfect. So I'm gonna just take a better feel at your liver. So I'm gonna have you take a nice deep breath. What you do, I'm just gonna push in real hard just to feel the size, and it doesn't appear to be enlarged. I'm gonna do the same thing with your spleen over here. All right, and go ahead, take a nice deep breath this time as well. And that doesn't appear to be enlarged either. So that all feels good. I'm gonna move on to your legs. We're gonna do a couple things sitting down. I'm just gonna palpate these, make sure they're nice and symmetrical, make sure there's no tenderness. Doesn't appear to be. I am gonna feel some pulses, some through your popliteal pulses on both legs. Alright, I'm gonna feel your posterior tibialis pulses. And your dorsalis pedis pulses. Okay, all those felt symmetrical. They're about a +2. I am going to do some range of motion of your legs. Just want to make sure the camera can see it before we sit up. So I'm gonna bring your leg up. I'm gonna stretch it out. Okay. Same with this one. Alright, and I don't feel any crepitus or resistance there. Go ahead, you can sit up. We're going to test some reflexes on your legs. Just going to get my reflex hammer. Alright, so I'm going to start with your patellar. Good. Alright, I'm going to do, we'll do the patellar on the side, and then we'll go down to your Achilles. Okay. This one's a little tricky. Okay, that one's good. And this one as well. Okay. That one was nice and brisk. So I'm gonna have you stand up. Go ahead, touch your toes. Just gonna test, make sure your spine's nice and straight and that you have good range of motion of your back. Go ahead and lean back. Good. All right. And then go from side to side. And then go ahead and twist. All right. And that all appears normal. Good. So go ahead and walk for me. I'm just going to assess your gait. So walk normal. Okay. And then come back, walk on your heels. Okay, and then go ahead, turn around and walk on your toes. All right, you can come back and have a seat. That all looked appropriate, and that concludes our assessment. Do you have any questions?
Nope.
All right, thanks.